Hi everyone, this is Mr. Neil Wright, consultant audiologist and director of ClearWax. I just want to wish everyone a happy new year and a great start to 2023. I hope you all had a lovely time celebrating yesterday evening. And I just wanted to kickstart the new year by uploading another demonstration video of our recently developed WAXscope, which is due to be imminently launched. In fact, I'm due our first spin-offs of the new speculum using our custom-made tooling machine, which I should be receiving, I've been advised, this forthcoming week. And once they're approved, the process should be relatively straightforward. So it all depends on the spin-offs that we receive. So I just initially took a video using the WAXscope endoscope, and this patient has very fizzy and bubbly earwax. They've been using hydrogen peroxide drops, and I really wanted to challenge myself by using the WAXscope in this particular case for the reason that this patient's got a very narrow and twisty bendy ear canal, and the wax was located right on the eardrum. And these are the procedures that I would probably originally really struggled with using an endoscope. So when I first started removing earwax, I was using head loops, so they're like head-worn microscopes. And I probably wouldn't have been able to even visualize that wax. So you can probably see here how bendy and twisty the ear canal is. We've managed to remove all the wax off the eardrum. I then used a fine end just to remove some debris off the back part of the eardrum, and also to the anterior superior quadrant where there was some wax on the roof of the ear canal. So I'm just trying to now stretch and straighten this patient's ear, because as I said, they've got a very, very bendy, twisty ear canal. And we can just about see the anterior portion of the patient's eardrum there. This is another patient that historically they come every year, and they've got a very narrow, not as bendy ear canal, but quite a narrow ear canal, especially towards the eardrum. They've got some stenosis. So stenosis is a narrowing of the ear canal, or also other orifices in the body. So it's not exclusive to the ears. And the most common cause of stenosis in the ear is due to chronic ear infections, and part of the healing process. There's inflammation of the bone and the skin that lines the bony part of the ear canal, and over time the ear canal just narrows. And that's left this patient with a chronic buildup of wax that can't naturally migrate out of the ear. So once more, if I was using loops, or I originally got trained in removing earwax, I would have really struggled with this particular case. I wouldn't be able to see as clearly as I am right now. So I've got the main bulk out. There's just some residual sticky wax at the back part of the eardrum. It's not really significant, but I felt really comfortable removing it. So just cleared some dead skin that was in the way. Again, just using a fine end, just delicately approaching this soft wax. And as you can see, it's coming away nice and easily. And again, this is right on the eardrum. And you can probably see how narrow this patient's ear canal is here. The fine end suction probe is just about fitting inferiorly where there's some dead skin. So I wouldn't have been able to insert a full-size Zollner suction probe this deep in the ear. It wouldn't have been, the ear canal was too narrow for all that. So once more in a moment, we're going to stretch and just trying to straighten this patient's ear. And we can just about see, we can see the hammer bone there to the left. And I'm just going to stretch straight, and we can just see a slight part of the anterior traumatic membrane. This is where an endoscope is a league of its own. An endoscope, you cannot compete with an endoscope in terms of optics, because you can see every little alcove, bend, twist in the ear canal. Well, I hope you enjoyed that video, guys. And if you are interested in the WAXscope, please do email info@clearwax.co.uk. Thank you.